You're listening to Building the Future, a podcast by Kadans Science Partner. And my name is Rudy van Beurden. In this podcast, I meet innovators, trailblazers, and bright minds who are busy building the future. The hospital of the future will be your own living room. If you listened to the previous episode of this Building the Future podcast, you know that in each episode we have a conversation with experts based on a provocative statement. This time we focus on healthcare in the future. Various companies and organizations are working on smart solutions where patients no longer necessarily have to go to the hospital for medical care. Will the hospital soon be a thing of the past, and can we just stay at home? We'll talk about this topic at an inspiring location, the MoveUP campus in Nijmegen. Yes, well, here we are at the very table. With me are Waander van Heerde, CSO, Chief Scientific Officer and co-founder of Enzyre. We've got Wanne Wiersinga, Lead Business Developer at NL MoveUP, and as well, right next to me, Koen van den Hurk, Innovation Manager with Health Valley for some 4 years now, if I'm correct. Good day to all of you.
Thank you.
Yes, here we are in this pop-up podcast studio at the MoveUP campus. And the statement we will be dealing with is the hospital of the future will be your own living room. And first, I would like to check whether you do agree or you disagree. Let's start off with Wanne. What do you think?
I agree. We are a healthcare provider and very much convinced that a lot of care can take place remotely in your own living room.
Fair enough. And then, Koen, do you agree or do you disagree with the statement?
I definitely agree with the statement that, but to a certain extent.
All right. And Waander, last but not least?
It's a very lovely idea, but I disagree because we are not that far yet.
It will take some time.
It takes more time because we need tools to do that.
Yeah. All right, we will get to know all of you a little bit better and obviously what you're doing as well. But let's start off with Wanne. You did say something already about providing care from a distance. Can you tell us a little bit more about that? What's MoveUP providing?
Yes, MoveUP provides digital therapy to improve safe recovery and rehabilitation, especially after an orthopedic surgery or bariatric surgery. And we see that providing that care remotely has a huge benefit to give patients the right information at the right time. So you can supervise patients daily, 24/7, which is very, very costly in a hospital. So we've already have a great experience in Belgium, where 2,000 patients have been followed up by MoveUP. And their patients report that they very much like it because now they don't have to wait a couple of weeks for their consultation, but have daily contact with a remote specialist team. And so they feel not alone any longer during rehabilitation. So they feel very safe, they feel monitored. And if they do have questions, they get an answer 24/7. So I think that patient satisfaction is crucial. Mm-hmm. And then, of course, we also have an increased involvement of specialists, which is a very good benefit as well. And I, on purpose, put it in this order that at last, or at least, we have also then decreased healthcare cost. Mm-hmm. But without patient satisfaction, people won't opt for the option to take to choose remote care. And I think we have a great example that it is possible to deliver higher quality of care in your own living room.
So, well, there you go. For these 2,000 people in Belgium, you actually took away the hospital already. You let them recover at home. Now you're trying to do the same in the Netherlands, obviously, to come up with your program here as well. But Waander, you're in a totally different field of health. It's not having to do with orthopedic surgeon, but something entirely different. And maybe then it's not possible to stay at home.
No, I think it's in principle a very, very elegant way to get patients to be adhered to the patients. That's definitely true. But for many diseases, it's not only just a phone call or a FaceTime discussion. It needs more. For example, you need some tools to measure your health status, or by measuring parameters in your blood, etc., etc. And at that stage, we are not there yet. There is perhaps a few examples. Diabetes, for example, is a very nice example. But in the field where I'm working in, coagulation, we don't have those tools really available for patients. And if we do have those tools, the doctors are not did not adapt it yet. So that's the next stage which we have to follow up. Remember, if a patient, I'm dealing with patient with hemophilia care, and if they have a problem, they call the doctor, they call the hemophilia treatment center, then they are advised what to do, and in most cases they are asked to inject their factor VIII again, for example, but they don't measure anything. And that might be a risk, because if you overdose, it might be a risk for thrombosis. On the other hand, it's costly. And to avoid that, it's better to monitor your treatment instead of just doing something empirically. And that's the idea. And I think we are not that far yet to do that. For example, if a patient now have to have a problem, an acute phase, then he has to go to the hospital, which is not very, he's not very enthusiastic to do that, because he has a lot of problems with his knees, etc. So it takes a lot of time to go to the hospital to measure their factor VIII or that parameter, go back to the doctor, etc. Of course, fantastic if we can do that in the future, but that's the disclaimer I have, that we don't have the proper, and we call it personalized diagnostic tools.
Yeah, so it takes some extra years, but maybe Koen, you can help from Health Valley, because you're a matchmaker it's like a networking program, isn't it? Or how do you call yourself? An organization that matches various health organizations with each other?
Yeah, we call ourselves a network organization, and what we do is we match and connect over 200 partners in healthcare innovation. So that's education, but also hospitals, other care organizations and entrepreneurs who are all willing to innovate in healthcare.
And regarding the statement, you said you do agree, but up until a certain height, what is the limit?
Well, I think that a lot of that the shift is already happening. So there's a lot of care already distributed to the homes of people. But I do think that certain surgical procedures, for instance, you still need a hospital-like setting to do those. And with that, there come a lot of other different treatments that can't be done at home yet. And I doubt if that will ever be possible to do that.
So maybe this will be a relevant question to all of you, actually, and feel free to interact with each other. But what is the hospital actually for? What is the actual relevance of a certain hospital? What do you think, Koen?
Well, at the moment, I think it's a clustering of all the different ways to treat and to make people healthier. And I think that there's also the shift that's happening, is that we're looking into keeping people healthier before they even have to go to the hospital. And I think that there's a lot of there's a lot of opportunity there to make the hospital a bit less important for people and bring that setting to home.
Fair enough. Others?
Wanne?
My vision of the future hospital is that you only go to the hospital if you need the medical surgery or you need the medical infrastructure. So for all consultations in advance or after that medical procedure, I think it's ideal when you get that care outside the hospital, preferably at home or in a different clinical setting. And so the hospital can get smaller and much actually more efficient. And then specialists get only to see the patients who really need their attention, and that other healthcare will be delivered or remotely or outside the hospital. And again, I think that is crucial. The monitoring I find very interesting. Waander just mentioned earlier. that continuous monitoring, it's actually not possible in hospital unless you stay in the hospital, and nobody wants to stay in the hospital longer than needed. So to really monitor patients outside the hospital, if we can provide that, that's really a benefit to you, to me, to the listener, that you get that monitoring outside the hospital as quick as possible. So at the moment you can get discharged, let's discharge, but make that possible with a very continuous flow, so everybody feels safe, also the surgeon feels safe, but especially the patient, that they know, okay, I'll be monitored continuously, but at home or in a different setting.
But that is already happening, actually. For instance, in the south, with COVID patients, actually, they send people home with a saturation monitor and oxygen, and with the right care and the right pathway towards home, people are already monitored at home. But it's a small step, I agree, and there are a lot of different patients already that are wanting to have that care at home, but they can't have it yet.
And where is this happening? In the south of the Netherlands?
The Netherlands.
Okay, in the south of the Netherlands already.
Yeah.
And Koen, it is happening luckily already, so I think it's a very good first step. And with COVID patients and with many patients, we see that people get discharged much earlier with after many different surgeries. But we can extend that much more, and I hope a bit quicker than we've done the last 5 to 10 years. So this is a very good start we've made, but let's continue that way. And that's also a question I've got, to you, but also to our listener, is it holding you back to get more care outside the hospital? And if so, what is holding us back? Because I think we have a lot of technology.
And perhaps first give an answer to your question, because to come back to that, of course, fantastic to do that. But I do see two groups in the hospital. We have the chronic patients, or we have the acute patients, and that's more or less another definition. So sometimes you need specialized care. You need the infrastructure of the hospital. You already mentioned, so that's completely true. But remember, I think when you look to all the outpatient clinics in our hospital, I think more than 50% is chronic diseases. And that should be avoided. And that's one part. Giving you an answer about continuous monitoring, yeah, I fully agree. That's where we are working on, to have tools that you can perform continuous monitoring on a daily basis, even that they don't have to go, because patients don't want to go for long-time monitoring. Also in my field, hemophilia, when we do a pharmacokinetic analysis, they have to be there for 3 days. They have to be there, and that's very costly. It's much more convenient if you can do that at home, for example. And finally, going to the COVID story, fantastic, of course, to have them the oxygen saturation tools, but I would have had a coagulation tool, because coagulation is one of the problems in COVID patients, and we don't have that.
To do it at home, you mean?
Yeah, because
people still have to go to the hospital.
If you can see, let's say, the increased risk of developing thrombosis, that would definitely help a lot, because that is probably the most important reason that they are hospitalized, in combination, of course, with the oxygen saturation.
Mm-hmm. So what do you see happening over the upcoming years, Waander, with your experience from working in the Radboud Hospital as well, and what the hospital should be for?
When I'm looking to the Radboud UMC, the idea is that it will be smaller compared to what it is now. And that's one thing. When I look again, coming back to the chronic patients, it's very costly to see them in that specialized hospital, because this is a university hospital which gives specialized care, and the square meter price is tremendously high. So if you want to have a lower price and better care, to my opinion, that's my feeling, you probably can better have, let's say, disease-driven care institutes. So really related to a specific disease, where you can get the specialized care you need. And that is not only to relate it, take again that hemophilia patient to the hematologist, but also physiotherapy, that you need an orthoped, etc. All these kind of disciplines all together, focusing on one disease. So it is a kind of care center.
Various
not
hubs.
on that location in a very which is very expensive, but in another location close to the hospital, a kind of hub or something like that.
Yeah.
I think that's possible, but it's also related to the amount of times that people have to go there. You can make a specialized hub, maybe even 1 or 2 in the Netherlands, if you only have to go there once a year, for instance. I mean, somebody that needs a new hip, for instance, wants the best specialized orthopedic surgeon to place that hip, and they are willing to travel for that. But during rehabilitation, coming back there every week, that's the problem then. So I think that offers a possibility.
I agree with you, because the hub is just an intermediate situation, perhaps. You can think about home as the hub in the future. But then you need, what I already mentioned, all the personalized care you can give.
Say that once again, Wander, you can't be the home. What was the sentence?
No, my suggestion is, now I'm talking about a hub, so that you have a different hub, but ideally it goes to the home situation.
Excellent.
But
yes.
it's
So your own
it's too
living
early.
room
What I
will be
wanted
the
to hear,
yeah.
yes.
That's music to your ears, isn't it, Wanne?
Yes.
But
And when
again,
you drive-
listen, you need the tools for that.
Yeah.
Yes.
But I'm sitting here and I'm not visiting hospitals regularly, luckily, but I can be a possible patient. And we've talked about this earlier on as well, that everyone, in fact, actually everyone who's listening could be a future patient. And what you mentioned earlier, Wanne, was saying what makes you go to the hospital, or in other words, what could benefit you from staying home, and what would be the hurdles in doing so. What are things that you found, maybe in a study in Belgium or from personal experience, that people really don't like going to the hospital or rather stay at home?
Yes. So what I hear very often from patients is that they like it that they don't have to drive to the hospital, and in our situation it's also very often to a physiotherapy center, so it's not always hospital, but they can actually do the therapy in their own time, in their own comfort, and avoid driving, avoid parking cost, so they stay with their family, they stay with their partner. That's what they very much like, and that's a bit of the younger generation, and we're not talking very young generation if we talk about orthopedic surgery. The average age is about 65, but let's say between 55 and 70, they very much like to be in control of their own time. And secondly, also, that they very much feel that what I said earlier, they don't feel alone. And that is actually for what I hear very often from the full population of patients. And I think that's for all of us. If we do something new, people are a bit of nervous and excited, but also like, okay, is this going to be good? And then by surprise, actually, they feel like, okay, normally I would tell my partner or my children, oh, it hurts, I'm disappointed. And now they tell it to a specialist from whom they get an answer within 24 hours. And that makes them like, okay, this is part of the recovery. It is fine to feel disappointed, but we're still on track. So I think that's a huge benefit. And the patient is not very much aware of it, but maybe that's also an interesting topic, I think, for you as well, Wander, is we get a lot of data when you treat patients remotely. And that gives actually then also surgeons, but the possibility to make better predictions about, in our case, how long the recovery will be. And after, for example, a new hip or a new knee, everybody would like to know, when can I walk again? That's the number one question.
Definitely.
Or when can I drive again? And if surgeons do the wrong prediction, people feel disappointed, although the surgery was perfect, but they thought, I can walk again after 3 weeks, and then it takes much longer. And so with getting all that data, you can give the right predictions, and if there is a setback, you can very well adjust the prediction or the expectation. It's all managing expectations, and also adjust the care plan. So giving the right activity or right medication and prevent worsening or even readmissions.
Yeah. And patient satisfaction, that's really the main driver. That's the one thing you're mentioning from MoveUp. Number one. Yeah,
really
that could be the reason why the hospitals of the future will be in your living room. Cost is also one aspect that you've been mentioning.
Yeah, I wanted to mention that too, because it's also an important item.
Definitely.
It's definitely, of course, it's to give more care to patients if you have monitoring at home, etc. But it's also cost-driven, especially when you are talking about, for my case, hemophilia, a very expensive treatment and improvement in care or in treatment plans, etc., is beneficial in that respect. So definitely, if we have more possibilities in that respect, it helps a lot.
Yeah, so the new technologies or the new combination of systems, how you treat patients at home or in accommodation in a hub or in a hospital should be actually also be cost effective.
Yeah, and the hub is not a nice example for the Netherlands. The Netherlands is too small for that, but for other countries it's more convenient to have the hubs, because then it can be that a specialized care center is 200 miles away. So that's a different story compared to the Netherlands. Yeah. If we are 200 miles away, we are out of the Netherlands.
Yeah. And to bring it into perspective, maybe you want to share the amount for a patient of hemophilia, because...
Yeah, the costs for to treat an hemophilic on a prophylactic base, that means that you are to avoid bleeding complications, so you treat them before that. It costs around 250 to 300,000 euros each year. And remember, it's congenital, so you start early on.
Mm-hmm. Yeah, so big numbers. Yeah.
Big numbers, yeah.
Koen, what are you thinking from this conversation? Is the hospital moving towards our living room? Is this something we actually want? Is this a good...
I think a lot has to do with behavioral change. There are two main drivers, I think, that will enable this whole change. It's, on the one hand, you have the enabling technologies like the sensoring or AI or even 5G that's mentioning to facilitate continuous monitoring. But on the other hand, I think also the behavior change of patients or people as in a whole and the medical professional is an important one. People need to be willing to take their own health in charge and be able to keep monitoring on their own health to make this happening. Mm-hmm. And I think that, for instance, the product like MoveUp does give people the potential to take charge. And I'm really curious also to hear what does that mean for these people? Do they also feel in charge, and how does that affect their treatment? But I think that could have a really positive effect also on that whole rehabilitation roadmap, and with that bring the opportunity to bring a lot of care to the home.
And how do you regard the hospitals and the patients as well? How is their mental flexibility actually regarding behavioral change? Because this is a whole new aspect, I think a very valid one as well. But whenever you want to change something within hospitals or even with medical specialists, they can be a little bit pride being involved, or maybe ethical issues as well. It's hard to change, or am I wrong? If the patient
change is always scary. That's that's the main thing, I guess. But I do know a lot of. I had some workshops in the past also with patients where I would like, if I want to know from a GP if my ankle hurts and if I have to do something about that, I will. If it's not too bad, I will send them a chat message or an email, and if I have an answer in 2 days, if it doesn't worsen, then I'm fine. But a lot of people still want to see their own GP, preferably maybe at home. And that's something that's really difficult to see that changing. And that's something that you really slowly have to help also people. So make it easy to make those little steps to take charge of your own.
Yeah, there's like a bigger plan taking generations to change actually, because the younger you are, the more comfortable you are with chatting or yeah.
I have 2 comments on that, because let's see, there are 2 main drivers to my opinion. First of all, the patient by themselves, of course. They should be willing to do it. But I think there is not a big problem in the patient, because patients are, what Wanne was already saying, they are interested to be monitored more frequently, etc. And having said that, I think the other is, of course, the physician or the specialist. Are they willing to do it? Because, to my opinion, they're rather conservative, first of all, and they don't want to be seen as a general practitioner. And to my opinion, that should also change. Because if you give a little bit more care, for example, when you are a hematologist, you can say something about your blood pressure or your cholesterol levels or something like that. So why should we go to another doctor for that aspect? And that's what I do miss. I miss that still a little bit. And also to adapt that you are in charge for that patient 24 hours, 7 days. To my opinion, it's not yet accepted by the physicians at all for the moment.
Is it maybe in other countries different compared to the Netherlands? Or is it similar?
No, I think we getting more specialists instead of generalists, let's say that way, which makes it that they are only focusing on their own, let's say, specialty instead of a general view. In the past, it was more open. The specialists were more generalists. They did all kinds of jobs together. But now it's changed, and that might also be the different way around. And finally, going back to the patient, because to my opinion, patients are in the lead, in my respect, there should be a benefit for the patient. If there is no benefit for the patient, like, for example, all the registries for all kinds of things, if there is no benefit for the patient, the patient will not adapt to that system. But if there is a benefit, surely they will immediately accept this change in treatment decisions, etc.
Yeah. I'm just wondering, I'm just picturing myself in my own living room, and then what happens, maybe a minor thing, and I just want to chat with someone. Maybe it can be automated, or being it artificial intelligence. I could be fine with that, when there will be a suitable answer for me. But then with other things, like I'm in the beginning of my 30s, and around me is this real baby boom happening with all my friends and relatives. And some of them really want to stay at home, picture themselves in this very romantic situation. And even though I can understand that, the rational part of my brain is thinking, why? Just go to the hospital, where you have the infrastructure, where you have all the specialists. So how could we come up with the division on what things we still should go to hospitals, and what other stuff can be done simply at home? Is there an easy division, or is this a very hard thing to do in the upcoming years?
I gave already my idea about chronic disease compared to specialized care, etc. So that's a different story, but that is my opinion.
That's one way to view various treatments.
I think an excellent way to do it, because it's manageable. That's it.
Yeah, I agree very much. So for the acute patients, you need the infrastructure at the hospital. And then for rehabilitation, for recovery, but also for chronic patients, you can do a lot remotely in the living room. Yes. And so as I think we also agree that patient satisfaction is number one. But Waander, a bit earlier you said a surgeon. It's crucial to have the surgeons on board as well, as they will be the ambassador and actually also advise patients. And I think that's also a good thing, that patients very much respect their surgeon. So the benefits for surgeons must be clear as well. And I think also that surgeons are very happy when their patients are satisfied, but also with that the distance between a medical surgery and a rehabilitation and recovery, that we can make that smaller, that they feel actually involved. That is also, I think, tremendously helpful for surgeons. And also then improving quality of care. That's one of the things that our Dutch surgeon told me, that he sees actually that we can deliver, or he delivers better quality as the distance becomes much smaller. And
that's what I was saying about care centers or something
exactly.
like that, related to one disease, which contains all the specialists involved in that disease. And I always take that example in the Radboud University Medical Center, that you have to walk from one department to the other department, which can be 2 kilometers away, which is for patients who are disabled, it's not very handy, as an example. And so there are several, and that is due to the specialization we have nowadays. But perhaps it's not always necessary for specific diseases
to go to the hospital.
But I think it's also based on scale. So the amount of patients that you can help in such a specialized center, if you make it a hub in a certain region, for instance. If we already have a shortage of people in healthcare, working in healthcare, delivering the right care, and if you are cutting that up into smaller pieces, then you still have to be able to deliver the right care to the right amount of people. Otherwise, you need even more people to provide that care.
I disagree with that. I've seen it already in the United States. Those hubs, or let's say those hemophilia treatment centers, standalone, independent of the hospital. It works fantastically as long as you have a proper population taken care for. Then it's a different story. Of course, when it are very small groups, then it is probably not interesting. But if it are larger groups of patients, then it's probably more interesting. But ideally, let's go to the home situation, definitely.
Yeah. So if you're, but then still, it's for certain specific patients, it could be possible because there's a large group of them being helped with such a hub. But for multiple diseases, I think that it's still really difficult. Even comorbidities, it could be really difficult that you still need different specialized centers. And then it's even easier to have that all in the same hospital.
Yeah, we disagree. Let's say it that way.
All right, maybe in the remaining time we still have, because the topic is very complex and there's so much involved with it, what are all of you personally or professionally focusing on in the upcoming years? And maybe the listener or people who are viewing this on YouTube could be able to help you in one way or another. Is there something that you can share from your organizations that you work on and that you need help for?
Yes, so MoveUP is providing a lot of care in Belgium already. So it's my responsibility to introduce the therapies here in the Netherlands. We work already with Amphia Hospital in Breda, and so the healthcare is reimbursed by CZ already. So I'm of course, excited to get other hospitals on board as well. So surgeons, patients, and insurance companies. And I hope that in a few months I can actually publish about the results, or we publish or report. Let's do another podcast.
Who knows?
About that we will get to see the same positive effects here in the Netherlands as in Belgium. I'm very happy to hear as well, also from you, but from our listeners, whether they are also enthusiastic to get more and more care. And MoveUp is just an example after an orthopedic or bariatric surgery, but of course we can do this in many more fields. To get more care at home, and that you feel more safe and personalized. So that's on my agenda.
Yeah.
So I hope we can introduce it in the Netherlands a bit quicker than we have done over the last 5 years. But I think we've done a great job already so far. And let's now really get it into speed.
Well, the energy is there, so to see and so to hear. Waander, what are you working on?
Yeah, listen, I was heading a thrombosis hemostasis lab, a specialized lab, for more than 17 years. And I've seen the struggle of the patients coming to the hospital to draw blood and to do the analysis. And since we have had proof of principle for new technology, I started Enzyre, which is for enzymatic reactions, the abbreviation. And the idea of Enzyre is to bring the lab to the patient at home, so that they can measure at home. Simple, like a diabetes patient is doing, just measuring their glucose. But in this case, with coagulation assays, which are a little bit more tricky compared to glucose measurements. And not only to measure one parameter, but multiple parameters in just a single drop of blood. That's where we are aiming for at Enzyre. And we are developing these tools. They should be portable, easy to handle, and the patient needs we would love that the patient take them with them when they are traveling on the go or something like that, so that in all cases they can measure their status.
And how often should they do this?
Depends on the disease status of that patient. But remember, patients, it's a safety question in most cases. When they have a traumatic or they have a bleed or when something has happened, they wanted to know their level. Where am I? And they are now trained to inject immediately their drug. But it would be much easier just to measure their level instead of just injecting themselves.
Yeah.
So that helps. So it's in most cases a safety thing, but on the other hand, it also saves a lot of money if you can do a personalized treatment plan, if you can give a personalized treatment plan. That's where Enzyre is working for.
And what is your horizon, your scope?
Oh, the scope is we are now developing the hardware, so the tools, and we hope that we can do the first clinical trials at the end of this year, beginning of next year, and then a multi-center trial at the end of 2022 or 23, something like that. Oh,
excellent. Within a few years already.
Yeah. And we have the assays for hemophilia already available, and so we can measure in just a few drops of blood, and that's, remember, we are measuring in less than 1 microliter. For perhaps not for everybody, everybody's aware what 1 microliter is, but remember that is approximately at least 1,000 times less compared to the standard hospital, as an indication.
Tiny amount of blood. Yeah. And then Koen from Health Valley.
Yeah, we always strive to stimulate innovation in healthcare, first of all via matchmaking. I'm hoping that we can do some really cool networking events live again to get people together and introduce them to each other. I could imagine that after this podcast, Wanne and I will have a chat of what Health Valley could do for MoveUp, but always on the lookout for innovative healthcare organizations or businesses that we can support.
Yeah. Well, right now we have been quite innovative, Koen, bringing your voice and vision as well from Wanne and Waander through the ether via podcasting, because obviously you did about 30 physical events, I guess, with Health Valley normally.
A year, yeah.
And now when the world starts opening up, maybe there could be a blend of different content holders, definitely. We all of us here have been spoken about the hospital of the future will be your own living room. For me, it's still a little bit, it's out there, and I love the idea that you can be helped while you're at home in the safety of your home. But a part of me, like if you want to feel secure and safe for those very acute situations, you really want to go to the hospital, and then please not having to walk for 2 kilometers before you find the right specialist, and having to pay for your parking, €5 an hour, which is a pain in the ass as well for visitors. Maybe some final thoughts or giveaways before we wrap it up. If people want to know more about MoveUp, Wanne, where do they go?
Yes, I want to say maybe because I hear that in some situations you're still hesitant, and I think that's a very healthy mind to have. I think you should. But I would like to turn it around that in so many situations, it can give you benefits. So I would then invite you to experience it yourself. So really experience it and see what it means to you, what it can do to you. And then you will experience the advantages. And I think that's the best way to make that change happen. So go for it. When you get the option, it's not in all areas possible yet, unfortunately. But in the areas where it is possible, do experience it. And I invite you and Waander and Koen, but of course everybody who's listening. So if you get the option and see what it brings to you.
Yeah, well, the sales pitch is there already. Yeah. MoveUp.care.
Well, I do think that we all want the same. It sometimes feels like entrepreneurs and hospitals are opposite of each other because they have different goals. But I think that eventually, like you mentioned, patient satisfaction is for everybody the main goal. But to emphasize, I would like to emphasize on that I think that we're all on the same side. Just have to know how we can bring that to
Yeah, I think the COVID pandemic has really shown that diagnostics, or let's say monitoring care, is very important. And let's take this possibility at this stage, that we put more in innovation in these kind of tools, because that drives a lot. And over here at the MoveUP Tech Campus, we are combining that with technology and let's say healthcare systems. But the Netherlands is so innovative in that respect. So let's put all efforts together and ask the government to put more energy in that. I think that's a very important step forward.
And probably more money as well.
That unfortunately always necessary for that.
Yeah, fair enough. Well, this is it. It's a wrap. Waander, Wanne and Koen, thank you so much for joining me here at this very table. You, dear listener, have been listening to Building the Future, a podcast by Kadans Science Partner. And thanks to our guests, Waander van Heerde from Enzyre, Wanne Wiersinga. I stumble upon it. Wanne Wiersinga from NL MoveUP and Koen van den Hurk from Health Valley. This episode was recorded in a building from Kadans Science Partner at the MoveUP Tech Campus in Nijmegen, the hotspot for health and high tech.
Thank you.
Great pleasure.
Thank you. If you want to find out more about this podcast or our guests, go to kadans.com/podcast. Here you'll also learn more about Kadans Science Partner and how it connects innovative organizations and ecosystems throughout Europe, helping them to work on sustainable solutions for the future. And do not forget to subscribe to this podcast in your favorite app so you won't miss our upcoming episodes. Thanks for listening, and my name is Rudy van Beurden.